So on April 19th, 2017, my office launched Aid Montana, addressing the impact of drugs, an initiative aimed at developing a comprehensive and strategic plan to combat Montana's growing substance abuse crisis. Today, as a part of our Aid Montana initiative, we are releasing a landmark report outlining what the state currently does to combat substance abuse. I'd like to thank the Governor's Office and our colleagues at numerous state agencies for their assistance and cooperation in providing information for this report. And I'd also like to thank members of my staff and our researcher, Katie Loveland from Loveland Consulting, for their work in putting this report together. This report contains information essential to our effort to reform and improve how Montana addresses the substance abuse crisis plaguing our state. Before we can move forward in the right direction, we need to know where we are right now. We must survey the lay of the land, and that's precisely what this report does. Our report will allow us to better identify how state resources are used to target substance abuse. From there, we will identify gaps and inefficiencies, what works and what doesn't work, and have a more complete understanding of how the state of Montana can better align efforts to enhance necessary communication and improve outcomes from those suffering from addiction, and also to improve efforts to prevent substance abuse altogether. Through our Aid Montana initiative, we're taking a look at all facets of substance abuse in our state, from excessive alcohol consumption and prescription drug abuse to the use of illicit drugs such as heroin and methamphetamine. Aid Montana aims to address it all. The report we are presenting today is a first version. We will be engaging with policymakers, including the legislature, the governor, and Montana's congressional delegation, to create updated iterations of this report in the months to come. I'd like to present a few statistics contained in this report that demonstrate the scope of the substance abuse problem in Montana. Since 1980, the drug offense rate in Montana has increased 559%. Methamphetamine violations are up over 500% in just the past 5 years. From 2010 to 2014, the total charges in Montana for the emergency room and hospital visits with a primary or secondary diagnosis of substance abuse totaled $796 million. Heroin violations have increased 1,557% from 2010 to 2015. The information contained in this report shows the state of Montana as a whole, as a number of efforts targeted to address substance abuse. It's also clear more work can be done to coordinate these efforts, fill gaps in services, discontinue ineffective programs, make other programs more efficient and effective, and collect more data on which programs are working and why. This report should serve as the starting point for discussions with legislators and other policymakers on the development of a comprehensive statewide strategic plan to combat substance abuse. The Department of Justice will be sharing this report with interim committees, associations, nonprofits, healthcare providers, law enforcement, educators, and others, urging stakeholders to come to the table with their ideas. This collaborative approach to addressing substance abuse is a huge undertaking, but it is worth our time and our full attention. The fiscal costs to state government are enormous. The impact on the state's economy is significant. The negative effect it has on our quality of life is immeasurable. And most importantly, the loss of life attributable to substance abuse disorders is tragic and preventable. The sooner we start moving towards thoughtful, evidence-based solutions, the more likely it is we will save lives and help communities everywhere in Montana. We look forward to working with interested parties in the months and years ahead.